It's been another developing story over the last 48 hours. President Cyril Ramaphosa confirming an initial payment of over 300 million rand will be made towards a vaccine procurement for COVID-19. It follows reports that our government had missed the first payment deadline to join what's called the COVAX Covid-19 vaccine distribution scheme. This would allow us to secure our first doses of a vaccine through the World Health Organization initiative to help poorer countries access the virus. For more on this, I'm joined now by Dr Sthembile Mbete, a senior political lecturer at the University of Pretoria. Dr. Mbete, good afternoon to you. I'm going to ask you to start at the beginning with me, I'm afraid. What, firstly, is COVAX?
All right, so thanks for having me. The market for vaccines is incredibly competitive, and especially for a vaccine for an illness such as COVID-19, which has swept through the whole world. And so it is immensely difficult for middle and low income countries to get access to vaccines, because what tends to happen is that wealthier countries basically outbid everyone to be able to have access to the vaccines from the pharmaceutical companies that are producing them. So what tends to happen then is that developing economies can join what is called a advanced market commitment. They sign up to these deals, which basically allows them to pool their bargaining power as smaller economies and be able to approach the pharmaceutical companies to get access to vaccines. And so COVAX is an AMC. It's an advanced market commitment mechanism that is allowing a number of low and middle income, but even some high income countries whose markets are too small, like New Zealand, to pool their resources and to be able to approach pharmaceutical companies to get access to a certain number of units of the vaccine as soon as the vaccines are available. There are about 9 vaccine trials or vaccine developments that COVAX is looking out for. We know that there are 3 that have been approved at the moment, but they're waiting for others then to come online.
Okay, so then the terms of this, I mean, what would we have to do to make sure that we're guaranteed some of these vaccines? And just to sort of try and put it in context for myself, I presume I recall that there was a suggestion that we would get the number of doses that would be, say, 10% of our population. And that would be for healthcare workers, elderly people, people living with diabetes, for example. So to get that, what do we have to do?
Indeed. So to get that, there's certain, within COVAX, there's different types of countries. So some countries that are much poorer are being sponsored. So they're going to be able to get the vaccine basically for free, donated, or at significantly lower cost. South Africa isn't one of the countries that can access that. And so we have to pay for the vaccine. We are self-financing. And the idea around the self-financing is almost to create a guarantee for countries like South Africa that aren't poor enough to get aid, but that aren't rich enough to outbid to be able to get the vaccine bilaterally necessarily, to be able to secure a certain amount of the vaccine through this COVAX scheme. But it's not clear how much of the vaccine or how many units of the vaccine we will be able to secure. And so what's been on the news over the past 48 hours is about the initial deposit that we would have had to pay in order to get access to this AMC. And there was a delay in the payment of that for a number of reasons. We heard yesterday from the president that 320 million would be paid from the Solidarity Fund. For that as an initial payment, but we still actually are not sure how much vaccine we'd have access to. The idea within COVAX in terms of the terms is that for high-income countries, they'd have access to maybe 10 to 50% of their vaccine needs. But just to put this into perspective, COVAX says that, or the Vaccine Alliance, which is one of the big organizers of COVAX, says that their anticipation is that there'll be 2 billion units of the vaccine available for the 78 countries that are signatories to COVAX by the end of 2021. So that's 2 billion units of the vaccine for 78 countries. Contrast that then with a country like Canada, which has already pre-purchased and pre-secured 414 million doses of COVID-19 vaccines from different sources, that it can start basically having access to as soon as those vaccines are approved and produced. And Canada is a country of 37 million people, just about. The COVAX countries represent nearly 70% of the world's population. So you see that there is significant inequality here about access and distribution that leads then to the uncertainty for a country like South Africa about how many units we really will have access to and when we'll have access to them. We hope that we'll have access by the end of next year. Earlier today, Professor Karim was speaking about perhaps having access by the middle of next year, but there's a great deal of uncertainty about how much vaccine we'll actually have access to. And this is then part of the considerations that the government has to make in deciding how much money from the fiscus to contribute to COVAX.
So Dr. Mbete, very quickly, and I realize this is very complex, there's nothing quick about it. This means then that it's a little bit of a gamble. So if you're the Solidarity Fund, or if you're the government or the president or the finance minister, you might think actually it would be better to, imagine how many face masks you could buy with 300 million rand, whether it might be a little bit of a gamble on a vaccine. And also, and I hate this, but the longer all of this goes on, the cheaper and easier it will be to get vaccines as well.
Certainly. And so part of the gamble is that, it may happen that if having a country with full vaccines then becomes a really important factor to participating in the global economy from next year, that it might be necessary for visas and for other conditions of trade, for example. And so it's not necessarily that you can just, take, hinge and take your bets and say, well, no, we'll just wait until there's more of the vaccine available and it's cheaper. So really, these are all the things that are being balanced by the government, together with the issues around our health system and, being able to store the vaccine, being able to give it out, being able to administer it, and being able to get it, is it appropriate for our population? These are all of the things and the aspects from a health perspective and from a systems perspective that the government has to consider as well.
Dr. Sthembile Mbete, I really appreciate the time and the explanation. Thank you very much indeed for that. All right, COVAX. Now, finally, I understand how it works.